Easy Eye Drop Guides, 3D Printing and DIY Alternatives. A video by Dr. John Davis AKKARA. The author holds no financial interest concerning materials discussed in this presentation. If you're someone who has tried to use an eye drop independently, this scene is all too relatable for you. You struggle to use it without someone's help, feeling almost helpless when you wait for their assistance. There are various steps in the eye drop administration process that has potential for error, hampering the treatment process. It's been over 3 decades since we came up with a solution to this dilemma, but the layman has never even heard of the solution. The eye drop guides. Eye drop guides revolutionize the way we administer eye drops. Designed to eliminate the stress associated with the process, these guides can significantly enhance accuracy and reduce contamination. Studies show that 28% of patients contaminate their eye drop bottle by touching their eye or face. Around 31% of patients miss the eye with the drop, and 48% of patients do not instill exactly 1 drop, leading to drop wastage. Missed drops at an individual level over a large scale translate to more bottles being sold. Makes one wonder if these guides not being a regular household apparatus like the electronic BP monitor or the glucometer isn't a coincidence. Let us look at the choices one has today if they decide to buy an eye drop guide. They come in a variety of models catering to patient-specific needs. Whether it be struggling to hold the bottle steady due to weak muscles or joint illness, or just plainly being overly apprehensive in anticipation of the drop leading to stressful blinks. There is the basic design that sits in the orbit and pushes inwards, moving the eyelids out and seating the eye drop without allowing contamination by avoiding tip contact. There are models with inbuilt mirrors further improving accuracy, and even models in which you can apply the drop using your fingertip or by an applicator directly into your eye, although the trade for this extreme convenience is questionable sterility. The only problem today is the exorbitant cost to buy one, with the average drop guide setting you back roughly 3,000 rupees. With more awareness and thereby more public demand for these devices, the prices are bound to come down to reasonable levels. In the meantime, let us look at alternative solutions. 3D printing is a one-stop solution when one needs customized parts or apparatus that isn't readily available in the market. The ease with which one can print their own eye drop guides is overlooked. Here we look at a few models whose files are readily available in open-source platforms for download. Much akin to downloading a picture and taking it to your local printing office, one only needs to download the model and get it printed from your nearest 3D printing shop. You can even customize the design for your specific comfort. Getting one of them printed would run you 200 rupees, and it holds amazingly well against the few branded ones available today. The fact remains that the main target population using eye drops are also the demographic that is least likely to go out of their way printing 3D models off the internet. A simple makeshift eye drop guide can be made at home just by cutting off the tip of your regular feeding bottle teat. These are already heavily run through R&D and are usually made out of superior quality materials. Made of 100% silicone, they reduce chance of abrasion injuries, are available in different sizes for infants and toddlers. They can be sterilized by boiling and is even microwave safe, all while costing you 40 rupees. By making this video, I'm hoping to encourage more of us to educate patients, especially the alarming number of elderly who we hear saying how they live in solitude, and anyone else who would prefer not to disturb their partner, children, or parents to give them eye drops every 4 hours. With various models to choose from, these guides cater to individual needs, ensuring everyone can manage their eye drops with ease. It's time to embrace this innovation and support those who might feel alone in their struggles.